Welcome to the Forte Sports Medicine and Orthopedics preoperative presentation for total shoulder replacement. This PowerPoint presentation will cover important details regarding how to prepare for your surgery, healing timelines, rehabilitation expectations, and return to activity guidelines. Let's start with how to prepare for the surgery. If you happen to live alone, please arrange to have somebody stay with you at least 3 to 4 days after surgery, especially at night. You'll be needing some help with the basic household procedures and dressing. You may need help for up to 1 to 2 weeks, depending on your health and the mobility status of your opposite arm, how well you can use it or not use it to get dressed and those types of tasks. Prepare ahead of time because you will not be able to actively use the surgery shoulder for any daily tasks at home, work, or driving for at least 4 weeks after surgery. You will need a lot of help for home tasks, dressing, meal prep, possibly pet care, and applying the sling and the cryo cuff device to ice your shoulder. It takes approximately 24 to 30 hours following surgery for the nerve block to resolve and for you to regain active use of your hand and elbow to assist in simple things like buttoning your shirt or do your exercises. Overall, you'll be in a sling for approximately 4 to 6 weeks after surgery. That is dependent upon your physician. Arrange transportation to your first 2 to 3 outpatient physical therapy appointments because you may not be driving by then. Other preparations, try to arrange items for easy access with your non-surgical arm. Maybe perhaps place those items on countertops or tables for easy access so that you don't have to bend over into lower drawers or reach up into high cabinets for items you use on a daily basis. Arrange your clothing if needed for easy reach to help reduce your risk of falls while you're wearing a sling. The sling can sometimes take away a little bit of your peripheral vision on that surgical side. So please keep your pathways and hallways clear. If you have any balance issues, please use a cane to navigate stairs or uneven surfaces during that first month. Please pick up any throw rugs by sinks and toilets the day before surgery, just to avoid falling or tripping over them when you come home. If needed, perhaps try to add some handrails or grab bars around the shower or the toilet to help stand and sit safely. And please stay off step stools, ladders for at least 2 to 3 months, as these increase the risk of falls. And it takes a solid 3 months for your shoulder to heal. Now we need for you to bring a few items with you into the surgery center on the day of surgery. Please bring your ID and insurance card. Either wear in or bring in a loose, comfortable clothing. Large button-down shirts work very well. It's easy to get the arm in and out, and you don't have to slide a shirt over your head. If you're a Dr. Bender patient, you would have been pre-fitted with your sling at our DME office. If you happen to have taken that home to practice with your caregiver to get it on and off, please make sure you bring that with you. That's very, very important that you bring that back with you the day of surgery. If by chance they fitted you with your sling and you decided to leave it with DME and not take it home, that sling will be brought to the surgery the day of surgery for you. If you happen to have a cryo cuff shoulder device, some patients have used one in the past. If you happen to have one, you can bring that with you. If you don't have one, don't worry about it. If you sleep with a breathing machine, a CPAP or a BiPAP machine, please bring that with you. They will put that on you in recovery to help you come out of your anesthesia much easier. If you are staying overnight or there's a possibility that you may stay overnight, please pack an overnight bag and bring that with you as well. So one of the first things we want to talk about in terms of what to do post-op is just learning to manage your pain and swelling. So you want to try to control and reduce your swelling and your pain, which is very critical for you to get comfortable during the day at rest and even at night. We want to reduce the pain to a low and tolerable level, which means on your pain scale of 0 to 10, 5 being kind of the moderate pain, middle of the line pain, we really want to try to keep your pain controlled below the 5 out of 10. This enables you to do your exercises and get dressed comfortably and rest comfortably. One of the things we'll do is to use some cold therapy. In general, we're going to use your cold therapy on your shoulder for about 30 minutes at a time. Take it off for maybe an hour, let it come to room temperature, and then place it back on. Ice will be your friend. You will find yourself using it a lot during that first week or two. Please make sure you always have a cloth barrier between your skin and the cuff device, or maybe it's an ice pack. And this helps to avoid skin irritation from the cold. It's very easy to stay in your sling while you're using your cold therapy device. There's no reason to get out of your sling to ice. As you look at the picture in the middle, the blue item is called a cryo cup. It is something that you purchase. The canister is filled with ice water, and there's a hose that connects to the hose. As you can see in the model there is a cuff that goes over your shoulder, and that cuff fills with ice water. The Vascutherm is a device that has water in it and a chiller, so no ice is needed. It also has a cuff very similar to the blue cryo cuff, and both of those items can be used. A representative from our Forte DME office will call you the day before surgery and discuss with you the cryotherapy options, and you can choose what you'd like to do. Other ways of managing your pain is this. We want to keep your arm in a sling at rest at all times. You can take your arm out whenever you're bathing or showering, getting dressed or undressed, or doing your rehabilitation exercises. We do want you to become proficient in comfortably putting on and removing the sling without actively moving the surgical arm. Your opposite hand can be used to self-assist your surgical arm, or you can have another person to passively help place your arm in and out of the sling. So the difference there, meaning active moving, refers to you using your own muscles to move your arm, versus passive, that refers to you using your non-surgical arm, or somebody else is moving your arm for you, so you're not engaging those muscles for the movement. The other thing we can do to help manage or reduce your pain is to very gently do some of the simple rehab exercises that you'll learn in your prehab physical therapy visit, but we'll also go over those later in the presentation today. At discharge, the nursing staff will go over in detail what post-op medications you will have and how to take them. So they will give you the directions, but oftentimes you can use over-the-counter medications, and you will also be prescribed a narcotic to help control pain as needed. Should you have any adverse side effects from any medication, please let your doctor know as soon as possible. Wound care. Wound care is pretty simple. The incisions will have absorbable sutures, and those sutures will be covered with gauze and a waterproof dressing to allow showering. Most of the time, the dressing is fairly clear or semi-opaque, so you can kind of sort of see through it. It covers the entire shoulder and all your incisions, and you can go ahead and let your shoulder get wet in the shower and then gently pat it dry. The only thing we don't want you to do is to submerge your shoulder in a bathtub or a hot tub or a pool. Inspect the dressings and the surrounding skin of your incisions every day for any skin irritation or possible infection. And the wound dressings are going to be changed by your doctor at your first visit with them, and that occurs 1 week post-op. They will take the waterproof dressing off. They will take any gauze pads off, and they will usually put steri strips over those. And those steri strips are kind of glued onto your skin, so they remain in place, and you can go ahead and shower with those in place as well. Those steri strips will usually fall off, or they can be removed in 2 to 3 weeks after application. It is okay to gently wash your incisions or around incisions with hands and soap and water once the steri strips are removed. Please do not scrub on them though. It is okay before that, at rest even, or at any time, you can lightly rub or massage your skin around incisions over the shoulder and the upper arm to help relieve pain and swelling. That is okay to do as long as it's comfortable. You will also notice that there'll be some numbness in certain places around your incision on your shoulder, and that's normal. Just some basic precautions here. During the first month post-op, assuming you're wearing your sling for 4 weeks, it may be 6, again, depending on the direction of your physician. We do want you to stay in your sling at all times, except when you are showering, getting dressed, undressed, and doing your rehab exercises. Again, let's stress, we don't actively want to move that shoulder, so don't lift your arm away from your body in any direction actively. That will cause shoulder motion. We're going to use a pendulum position, which is a passive way to wash underneath your armpit, put on your deodorant, dress the upper body, and take your sling on and off. We're going to demonstrate that later in the presentation. Sometimes we have a tendency to use our arms to help stand up and sit down. We don't want to do that. And please don't carry anything heavier than 1 pound in the surgery hand until you're out of the sling. Post-op, you're going to wake up from surgery to find your arm in the sling and the cryo cuff device on your shoulder. The nerve block will be in full effect, and that prevents any arm control for about 24 to maybe 30 hours. So you're going to need some assistance with dressing and self-care because that arm will not be able to move on its own. The nerve block slowly resolves, and when it does, it starts resolving from the fingertips and slowly, gradually moves up the arm. The last area of numbness to resolve will be where the injection site is, which is around your neck. Someone will have to help support your arm until you have full motor control. So once that numbness starts to wear off, and you'll notice you'll start to get your finger motion a little bit, we would like you to try to do these exercises the same day of surgery. You don't have to come out of the sling. We prefer you to stay in the sling while you do these exercises. So they're very simple. As the numbness wears off, try to simply open and close your hand frequently throughout the day. As the numbness continues to wear off, your hand motion and all these motions will get more normal in terms of how far you can move. Then start to try to move your wrist back and forth, maybe side to side, and then making some small circles. And we're going to try to do about 10 repetitions of each in each direction. Overall, we're going to do your exercises 4 times a day. If your neck feels tight and stiff, it is quite okay to move your neck gently to stretch it and regain your neck motion again. The next day after surgery, more motor control has returned. And as it returns, we're going to add a few more exercises. So you can come out of your sling. You may still have to assist that arm because it may still be a little numb, which is normal. And we're going to add these exercises to it. So I do want you to start off with hand pumps, moving your wrist around, and then we can add these next ones the next day, these exercises the next day. The first one there, simply bend and straighten your elbow while keeping your elbow at your side. That is easy to do. It may not be very full range of motion at first, and it is okay if you need a little bit of help from your other hand to bend and straighten with control, go ahead and use it. The next exercise we'd like you to do, we want you to keep your elbow at your side, but bend your elbow a little bit and simply turn your palm up and down. Again, we'll do 10 repetitions of that 4 times a day. The next exercise is simply to gently squeeze your shoulder blades together without pulling your arms back. Once you squeeze the shoulder blades, give it a 5-second hold and then relax for 5 seconds. 10 repetitions there, 4 times a day. The next exercise is to gently start to roll your shoulders forward, maybe about 5 to 10 repetitions one direction, and then the other direction 5 to 10 times. All these exercises are done 4 times a day. Your pendulum, as you can see in this little picture here on the right-hand part of your screen, this is the exercise or the position that you can be in that allows you to very slowly bend forward and allow that arm to gradually move away from your torso and allow it to dangle. You can use this position to help get dressed, put your shirt on. Yeah, that's a good position to move your arm away from your body enough that you can wash underneath your armpit or get your deodorant on. The thing that you need to remember is don't bend so far forward that you create shoulder pain. This should be a pain-free, feel-good kind of position. Once you go forward, and at first you're not going to go bend forward very far. It'll be just a little bit, and your shoulder will say, "Oh, that's too far." So just back up a little bit to a pain-free position. And then you can gently, very slowly, just some relaxed little baby arm swings in circles, maybe 10 times one direction and 10 times the other direction. Some patients find it uncomfortable to do these small arm circles, so you can just let your arms simply dangle if that's more comfortable. We kind of like you to start your whole exercise routine with this pendulum exercise. It's kind of a warm-up for the other exercises. So perhaps you can do 4 or 5 repetitions first, then go to your other exercises like bending and straightening the elbow, turning the palm up and down, squeezing your shoulder blades, etc. And then at the end, do 4 or 5 more reps of this pendulum. It kind of takes the edge off the soreness from doing your other exercises. The pendulum should feel good to do. And in addition to doing this with your exercises 4 times a day, you can do it a few more times if it helps to reduce some of your shoulder pain. And oftentimes at night, this is when patients get a little more achy and painful because they're not moving around as they are during the day. And sometimes they can't get to sleep. So if you want to wake up in a well-lit area, slowly take your sling off and allow your arm to dangle forward in the pendulum fashion. That can sometimes take the edge off of that pain and allow you to be more comfortable to get back to sleep. And that's perfectly fine to do. In regards to getting yourself dressed and the best type of clothing to wear, I tell you what works well is either a zip up or a button down shirt. That's very easy to get on and off because you can open up the shirt. We always place your surgical arm in first when you're dressing, and then when you undress, we want to take that surgical arm out last. So you dress your surgical arm first and you undress it last. If you live by yourself, if you Google search post-shoulder surgery shirts, if you want something with a little easier access, you might find a shirt there that is more convenient for you to use. Most patients don't need that. Many of them will just simply use a button-down apparel or a zipper type of apparel, and it makes it very easy to get on and off. Shirts where you have to pull them over your head, that's a little more difficult to do. It can be done, but it's a little more difficult to do. Ladies, in terms of wearing bras, front closure is easy to do because you are able to bend your elbow to button shirts and close that front closure. The strap of a bra tends to lay right over the incision on the front of your shoulder. So oftentimes that just lays over the edge of your shoulder, or if you don't want to wear one, you don't even have to. In terms of sleeping and some bed mobility, you do need to wear your sling to sleep at night. You can sleep in a recliner with a pillow behind the shoulder or the upper arm as needed for comfort. If you are in a recliner, please do not use your surgical arm to use the lever to put your footrest up. Okay. You can also sleep in any kind of semi-reclined position, either in the bed or on the couch. If you want to use a soft wedge type pillow under your torso to help get you into that position, that's okay to do. Sleeping at night for the first 7 to 10 days is kind of you kind of tossing and turning and constantly changing position. It's a little tough to do. but you will find a comfortable position. So any position that's comfortable for you while you're in your sling
This is a test page.
is
Please
okay
disregard.
to
This
do.
is a test page. Please disregard.
So some basic activity modifications. Again, don't actively use your surgical arm to lift it away from the body in any direction. Don't hold on to things like you're opening jars or tight lids or push and pull on doors. If you want to type with a keyboard, it's acceptable, but we would ask that you keep your keyboard in a low position, preferably on your lap where you're not reaching forward with your arms to type. And definitely don't reach out to use a mouse. Vigorous use of your non-operative arm can make your surgical shoulder sore in those first couple of weeks, so just take caution to that. And we'd like you not to go outside walking for exercise for the first couple of weeks, just to avoid possibly tripping and falling out there. Stay off footstools and ladders and use the stairs only as necessary as you needed if your balance is a little, if you have any balance issues. By the end of the first month, pain and swelling are usually minimal. You have normal active hand, wrist, and elbow motion, and you use that to help you get dressed. You're very independent and confident in dressing, showering, and doing exercises without any issues, and oftentimes independent with that. When you come back for your first post-op visit with the doctor, you'll also see physical therapy, and they are going to show you 2 new exercises. I will not cover those here. But when you come back at the end of your month, we should be able to move your arm passively, your shoulder, to about 100 degrees, and then also rotate it out maybe 30 degrees or so. And that is how far we go with that is dependent upon your surgeon's direction at the time of surgery. Whenever you're doing your exercises, please do not exceed pushing more than a 3 out of 10 on the pain scale for the first 4 to 6 weeks post-op. This helps reduce your chance of increasing soreness and swelling and inflammation in your shoulder and keeps it more comfortable. In terms of physical therapy, the exercises that we went through in this presentation, the ones you can start the same day as your numbness starts to wear off, and the exercises that you'll start the day after at home, you'll start those on your own and you'll do those for that first week post-op. You'll come back at the end of your first week. You'll see your physician and the PT visit. Depending on how you're doing, the therapist may have you come back in about a week and a half or so at that 2.5 week post-op mark. If not, you'll return to see the doctor and PT at your 1 month post-op mark. At that point in time, you'll see physical therapy 1 to 2 times a week for 2 to 3 months, or until your shoulder function is optimal for what it is you want to be able to do. So in general, PT goals, we need to resolve swelling and pain to improve joint motion back to its normal capacity. We want to achieve good shoulder and scapula strength. Your scapula is your shoulder blade. Your shoulder joint is made of your upper arm bone and your scapula. Those 2 bones together create your shoulder joint. So the muscles that surround your scapula need to be nice and strong to provide stability to your shoulder joint once it's rehabbed. And then our big goal is to return you back to doing any normal activities of daily living, driving, reaching, lifting, etc., without pain. And then whatever your goals are, if your goal is to be able to hike or to fish again, we want you to be able to do that. So we get you ready to do that. To go back to driving, the most important thing is that you're off your narcotics. That you have to be. Secondly, you really got to be comfortable and safe driving with a steering wheel. Now, since your arm's in a sling for about 4 weeks, you really can't use that arm at all for driving. So most people are not driving for the first month. So really, as soon as you come out of your sling, you can begin the process of being able to drive if you feel you're safe and can control your steering wheel. In general, activity after the total shoulder replacement, again, probably around that 6 to 8 week after surgery, you're going to be resuming most of your light activities of daily living very comfortably. If you overdo it, there are still limitations to your shoulder, and it will let you know. So please just move and work and live life within the limits of your shoulder at that point in time. Your shoulder will still be somewhat sore with some activity, and even at night, that's not uncommon for several weeks after surgery. It can be a sign that maybe you overused it that day, especially if you haven't had any night pain for several weeks or several days, and suddenly your shoulder hurts a lot at night. That's a sign that maybe you overdid it that day, or you have been overdoing it. So you just want to let it rest a little bit longer, maybe ice, and resolve that pain. The rehab program generally includes performing specific exercises to progressively increase shoulder motion, strength, and endurance, and coordination, so we can return to your recreational exercise. And exercise tasks that require reaching, lifting, carrying, like a bag of groceries, stirring, push-pull, that imitate daily activities. We will give you those types of exercises to help you get back into those tasks. Thank you for listening to the presentation today. We do appreciate you choosing Forte for your upcoming total joint replacement surgery, and the entire Forte staff is looking forward to serving you throughout your surgical and rehabilitation experience. Our goal together, we will return you to an active lifestyle. Just an important footnote here. Most everybody prior to surgery will be scheduled for what we call a prehab physical therapy appointment. This is a one-on-one appointment with a physical therapist who specializes in total joint replacement, patient education, and rehabilitation. This is a short 35-minute prehab appointment with the PT, and it's going to focus on a brief history, a physical exam of your shoulder, and then we'll give you some instruction on specific equipment that you need to meet your needs in your home environment. We'll address strategies to help reduce pain and swelling again, highlight your rehab goals. We'll teach you a safe way to put your sling on and off, and hopefully your caregivers with you, and we can teach them as well. And review some sleeping positions and answer your questions so that you feel more prepared going into this surgery. The Forte Rehabilitation Department, or the Physical Therapy Department, is located on the first floor in our building. So to prepare for that visit, it's extremely useful for you if you can read the Forte Joint Replacement book, in addition to listening to this PowerPoint presentation today. So again, we thank you very much for your participation, and we look forward to seeing you. Thanks, Janet.
You're welcome.
Were you listening the whole time by any chance?